Hi there. It's been great working with you to move the needle on issues of heart disease and stroke here in South Dakota. Knowing that it's a priority for you to improve the quality of life of South Dakotans in your community and across the state, I think you'd make a great addition to the South Dakota Cardiovascular Collaborative. Let me tell you more about it. The South Dakota Cardiovascular Collaborative works to improve quality of life for all through the prevention and management of cardiovascular disease and associated risk factors. The collaborative was launched in 2017. Since then, we've grown from a couple dozen individuals to more than 90, with over 45 organizations represented across the state. As medical and public health representatives, we have come together to combine resources, tools, and expertise to create momentum and champion heart disease and stroke issues within South Dakota. Heart disease touches us all. As the number one killer of South Dakotans, each of us has our own story about the ways our friends, family members, or even our own lives have been impacted. That's what makes the work of the Cardiovascular Collaborative so important. We're working hard to create longer, healthier lives for all South Dakota residents, which is no easy feat. There are lots of factors working against us, including tobacco use, rising obesity rates, shrinking physical activity, and unhealthy eating patterns. Our challenge is a big one, but we have a vision of healthy people, healthy communities, and a healthy South Dakota that propels our work forward. This work is oriented by a 5-year statewide strategic plan that we as collaborative members address in specific goal groups. We are working to accomplish these goals by developing partnerships, promoting new practices, and creating resources and tools. We've already made great strides towards these goals with a number of successful initiatives. Early on, we assessed cardiovascular data collection processes among 150 individuals representing health facilities across the state. When the survey assessment revealed a need for greater quality improvement in team-based care efforts, a series of toolkits and webinars were created to help close the gap. In an effort to create awareness around prevention and management of heart disease and stroke, a multimedia toolkit was also developed. Strengthening the ability of communities to respond to cardiac events was also carried out through the Cardiac Ready Communities program. Later on, to support the state in promoting the community health worker profession, a CHW toolkit was developed to provide background knowledge and recommendations for hiring and utilizing a CHW. These combined resources and activities not only bolster the work of the collaborative, but benefit the partners and communities who are so important to these initiatives. None of this is possible without people like you, though, as the heart of the collaborative is its members. By joining the collaborative, you will have the opportunity to network with, learn from, and work alongside diverse and like-minded individuals. Together, we will advance the shared goal of improving the quality of life and health of South Dakotans in our communities and across the state. With your commitment to prevention and control of heart disease and stroke, I just know you'd make a great addition to the collaborative. Now all you have to do is reach out and pick the goal group that is right for you to get started. Can't wait to continue working with you to improve the lives of residents here in South Dakota.